UnitedHealthcare executive gunned down on the streets of New York City. Incredible. We're going to break the whole thing down next on Hey Doc. Hey Doc audience, everybody's heard about the shooting of the UnitedHealthcare executive Brian Thompson on the streets of New York while he was entering a place holding a board meeting. Rod, this is it's a crazy story. It was really almost like an assassination. The perpetrator has been caught. He's actually a younger gentleman, but I think there's a lot of messages here, maybe some things that are misunderstood, but what do you think?
Well, I think it is, first of all, it is a tragedy. And the thing that we need to be very clear about, as physicians and as Americans, you just can't kill somebody on the street for any reason. So that's wrong. So to, make him a hero of some cause is completely crazy and should not be done. But if you look at social media, they've literally done that. I mean, when I look at TikTok and Instagram, they really say crazy things. And granted, there's a lot of things going on here, especially the American healthcare system is broken, but you don't kill somebody because it's broken. But it does highlight a lot of issues around what's going on in American healthcare. And our healthcare system is broken. But, there's a lot of things you can do short of what was done. But it does highlight this issue. But he's a killer, and I think he's been charged with first-degree murder, which he should be. And of course, it's on videotape, and they caught him in a McDonald's with all of the goods. So I think that's going to probably go the way the way it should.
Well, there's a lot to talk about with this story. You have certainly big business, medicine, insurance companies.
Right.
I think what I see a lot of people out there, they don't understand. They're, oh my God, this is terrible, and it is terrible. And certainly nothing we're saying here is trying to justify what happened. As you've already said, it's a tragedy. It's not correct, but there's been speculation. The insurance companies are really, they're certainly not the solution for medicine, and they're part of the problem.
Right. And they shouldn't be lauded as Wall Street heroes for their incredible earnings on the backs of patients and physicians. And,
right.
And one of the most amazing facts is that the cost of healthcare is predominantly that of hospitals and pharmaceuticals. Physicians that care for the patients are a small amount of the healthcare expenditure in this country. And I think people need to know that. And the other thing is, as you mentioned, Bill, we've lost control of who's in charge. We're in charge of the patients, but are we really? Because we have to get approval. And when companies say you don't get approved and it's somebody that's overseas that doesn't even know your patient, that's pretty devastating to patients and to physicians. I know when I was doing insurance-based healthcare, that was always a struggle. We had many employees that had to do that work. It was unnecessary.
Yeah, no doubt. And by the way, make sure to subscribe, hit the like button, and also turn on your notifications so next time we break down a tragedy like this, you know exactly when that news on Hey Doc breaks. I think, Rod, just what you're saying is really, it's very true. That it's sad when patients, for example, can't get the proper care they want, or, there's some, you guys let us know what you think and put your comments in. The comments are going to say, what are these guys talking about this? They're plastic surgeons. And it's true. We're in a specialty that really, at least for part of what you do in plastic surgery, is not really affected by insurance. So full disclosure, but we still understand this and we still see things, and we actually still do insurance-based work. So we have some insights into it. But what I see, and having known a lot of physicians, there's physicians out there that can't even pay their staff because they've been cut so low with reimbursement. When then you have these CEOs and executives and these insurance companies making 30, 40, $50 million a year
or more.
That's just ridiculous, because The physicians are the ones that are taking care of the sick people and the people that need good care. And so it is a broken system. I don't know what the solution is. What do you see as the solution to the problem?
I think physicians need to take back the healthcare of this country. So it needs to be physician-based and not profit-based, but probably preventive-based. We need to be in the prevention of diseases, not rewarding for causing diseases, and we need to get away from the incredible excess costs of hospital care and pharmaceutical care. When you look at America, which I think, we have a great healthcare system if you know how to get into it, but our hospital costs and our pharmaceutical costs are out of this world compared to other countries, in Europe that actually have fairly good healthcare. So we need to refocus, take medicine back, get it out of the hands of the business people, put it back in physicians and patients so that they can get best care. And right now we are on a downward curve of not doing that. And I don't see that window changing unless there's some radical changes. And I don't mean nationalized healthcare, because we all know how that works. And to our neighbor to the north and in Europe, that's nothing short of a disaster. But we need to find a common middle ground.
Yeah, and there are some that laud, like for example, Obamacare was a great.
That's a disaster.
Wasn't a great solution because the problem is the way that was put together. Nothing changed. The insurance, it actually allowed the insurance companies to do more of what the problem we just been discussing.
Exactly.
And the other part of it, the way it was set up, because I know people that have, had signed up on Obamacare plans, and what happened was nobody to take the patients. Because the plans are so bad. If you're a physician's office and you're like, I can't keep my doors open with this, accepting this plan, it's not a solution, and that's the problem. These legislators, the bureaucrats, the businessmen, they all have their so-called solutions, but they don't care about the people given the care.
Exactly. They should all have to take Obamacare, because I don't know of any hospital in Dallas that takes Obamacare today. I mean, they don't. And because, just like you said, hospitals, physicians, they can't afford to do it. I mean, it's a loss leader. So it's actually a disaster. And I think that's been what's cascaded into this other disaster. But I think, and on a positive note, we can do things to take it back. We need to get medicine back to physicians' decision making. And this sign of, we have to do authorization, that's got to go. And we need the AMA to stand up for us. We need the government to stand up for us, because how can a physician say it's indicated and then have somebody in Bangladesh or some other place on a computer say it's not valid? That's not true. And I think, and we shouldn't be rewarding these people on Wall Street for that.
Yeah, no doubt. And also we should shout out to just the law enforcement people, because you saw how quick they tracked down the guy, the perpetrator, and put him behind bars, which is where he should be. So, all right, well, that's great stuff, Rod. Thanks for joining us on this episode of Hey Doc, where we explored the tragic events surrounding the assassination of Brian Thompson. These stories are important to discuss and reflect on and learn from, and we'd love to hear your thoughts below in the comments.